Hello, my name is Jorge. I'm going to be the nurse practitioner observing you today. Is it okay if I do a quick assessment on you?
Of course.
Perfect. Okay, so we're going to go ahead and we're going to start our assessment. We're going to start it in a head to toe fashion. So I'm going to go ahead and first I'm going to start by observing my patient. She's showing me her nice smile, showing me her white teeth. So I'm kind of already testing some of the cranial nerves. I'm seeing that she does have symmetry. There's no asymmetry that she has. I'm able to see that her smile is equal, and I see that there's no asymmetry on the eyebrows, and I'm also looking for symmetrical any type of drops of the lids, of the lower lids. So what I'm going to go ahead and do is I'm going to ask her to begin starting to do some general movements for me, okay? So if I can I'm going to ask you, can you raise both of your eyebrows up for me? Good. Now put them back down. Do it again. Good. Okay. Now we're going to try something else. I want you to do me a favor, and I want you to give me a big puff of your cheeks like a blowfish, okay? You're going to go. Okay? Good. Now release it. All right. One more time. Okay. So pretty much when I'm having her make these movements, I'm checking for the symmetrical movements of her face. Go ahead and smile for me. Show me your teeth. Good. Now relax. Do it again for me. And the only reason I'm having her do it again for me is just I'm making sure that we do have a symmetrical smile and that she's showing her teeth equally. At the same time, I'm observing the color of her teeth, making sure that they are white and they are nice and pearly white. I can tell she brushes her teeth. And I'm making sure that there's no gaps, there's no abnormalities in the gums. I am able to see her gums. Is it okay if I touch your face real quick? I'm going to go ahead and pull your lip down. Perfect. I am able to see her gums. I don't see no swelling, no edema, no bruising, no bleeding, anything to show me that she has any type of gum disease. Okay, so now I'm going to ask you to do one more face for me, okay? Do you think you could frown for me? Perfect. Oh, she got a little shy on that one. But I'm going to continue. I'm going to ask her to do it one more time just because she did smile after I asked her to frown. So go ahead and frown for me, okay? And try your best to hold it. Give me a good frown. Good. So the frown is symmetrical. I'm making sure that everything is symmetrical on her face. I'm checking her eyebrows. I'm going to make sure that there's even distribution of hair, that they are nice and the same. I am also going to be looking at her eyelashes, making sure that there's even distribution in the eyelashes. I'm going to move your hair to the back, okay? I do see that everything is nice and symmetrical. She has even distribution on her eyebrows, and she has even distribution of her lashes as well. I'm going to go ahead and take this opportunity as well so that I could assess her head. So when I'm assessing her head, I'm looking at the contour and the shape of the scalp. I'm going to remove this real quick, okay? Just so I can get a better look at it. Sorry, I don't mean to pull your hair. So pretty much what I'm looking is I'm looking at the contour of the scalp, making sure that it's nice and it's symmetrical and it's got a nice round shape. I'm looking for any deformities, which I don't see, I don't feel. I'm also looking at hair distribution, making sure that there's no missing hair, making sure that distribution is equal on all sides, which I do see even hair distribution across her whole head. No asymmetric or any type of deformities along the head. Now what I'm going to go ahead and do is I'm going to go ahead and I'm going to ask her to go ahead and look up for me. Go ahead and look up. While I have her looking up, I'm going to be checking for the trachea, making sure that it's nice in midline. And it is nice in midline. I don't see no deviation to either side. And as you can see right now, she did swallow, but I'm going to go ahead and I'm going to ask her to do that for me again. This time while she's swallowing, I'm going to be feeling and I'm going to be making sure that I feel all her muscles moving up and down as to go ahead and conduct her swallowing mechanisms. So, okay. Go ahead and swallow for me. Perfect. I was able to feel all her muscles moving, and at the same time, while I'm having her looking up, go ahead and keep looking up for me. I'm also going to be palpating for the thyroid. Okay. So I am going to be palpating the thyroid, making sure that it is equal and that there's no, deformities of the thyroid, that it's not swollen on any either side. I'm also going to be feeling for her lymph nodes, and I do feel her lymph nodes right here. They are a little palpable. I feel them on both sides, and I don't feel any swelling in any of the lymph nodes. Since I am still working on the head, I'm going to go ahead and take the opportunity. I'm going to observe her tongue. What I'm going to do is I'm going to be asking her to do some movements of her tongue. It's going to be assessing her cranial nerves. I'm going to ask her to stick her tongue out for me. I'm going to ask her to say ah. I'm going to be checking for the rise and fall of the uvula, making sure that the tongue is symmetrical, making sure that I don't have no any type of protrusion on the tongue and that the tongue is to one side. I'm also going to be making sure that she doesn't have any abnormalities in her mouth, making sure she doesn't have any lesions as well. So I'm going to go ahead and start right here. I'm going to bring this chair right there to the side so I can go ahead and sit down. Okay, so now what I'm going to ask you to do is I want you to open your tongue, your mouth, nice and big for me, okay? So while she's opening her mouth, I'm going to check her oral mucosa. I'm going to check the soft palate. I'm going to check the upper palate. Go ahead and lift your tongue for me, sweetie. Up, there you go. I'm checking her lower palate. I'm checking her teeth. Making sure that her teeth are nice, equal, and white. And they are. Okay, now I'm going to ask you to go ahead and stick your tongue out for me. Okay? So I do see the uvula while keeping your tongue out. No, don't pick your tongue out. While keeping your tongue out, I'm going to ask you to say, ah. Good. I'm making sure that she doesn't have no swelling of her tonsils. I'm also making sure that when she says ah, that the uvula is actually moving up and down. Bless you. I'm going to be observing for that as well. So one more time, go ahead and open up. Say ah. I do see that rise and fall of the uvula. Now I'm going to go ahead and I'm going to ask her, go ahead and move your tongue side to side. Good. Up and down. Good. Okay. So this is the part where I am going to be checking for gag reflexes. Again, it's the test of the cranial nerves. Before I do that though, I am going to explain to her what I'm going to do and just let her know that it's a little bit of an uncomfortable feeling. Okay. So I'm going to have to press down on your tongue, okay? You're going to feel like you need to throw up a little. It's normal. That's the kind of reaction that we want, okay? All right, so go ahead and open your mouth. Okay, here we go. No, don't put your tongue in. There you go. So that did stimulate the gag reflex again right there. What we're doing is we're checking, making sure that we are having that nice gag reflex. I'm going to take this opportunity as well. I did check her... I was able to check her mouth. I'm going to go ahead and check her nose now. So what I'm going to be doing is I'm going to be looking inside to her nose. First, I'm going to have her look up. I'm going to check the mucosa again. I'm going to make sure that I don't see no abnormalities. I'm also going to be checking the septum, making sure that I don't have no deviated septum and that I don't have no no discolorations or any of that sort. Okay? So what I'm going to do is I'm going to need you to look up for me. Okay? So I'm first observing without... I'm going to go ahead and take my tools. I'm going to go ahead and look in her nose. I'm going to lift up her nose a little. And I'm going to look in there. Okay. Good. And it is nice and pink. Alright. There we go. Now we're going to check the other side. Is that okay? Alright. So I'm going to pick the nose up again. There we go. Sorry. You okay? Alright. Perfect. Now I'm going to go ahead and change my cap because I do also want to go ahead and check her ears now. So, since I am going to be right here working on her ears, I'm going to go ahead and be checking and making sure I have a nice gray pearly-ish type of eardrum, making sure that there's no rupture, make sure that I don't see no water. I am also going to take this opportunity to go ahead and do a Ryan and Weber test. That's going to be when I put the, the tuning fork on the middle of her forehead, make sure that she's hearing appropriately on both sides, and then I'm also going to do just a hearing test on the side as well. Okay, so what I'm going to do is I'm going to check your ears. Is that okay? Okay, perfect. So I'm going to start off with her right ear, and of course what we do to one side, we're always going to do to the other, just comparing them, making sure that we do have even look, and we do have, they do look a little comparable. Now for her, if it's a child 2 or less, you're going to pull down and out, and for her, I'm going to pull up and out. Okay, so in this ear, she does have a lot of cerumen, so I'm unable to view the oh, there it is. Okay, so I do have a nice, pretty gray linking tympanic membrane. Perfect. Okay, so now I'm going to take the opportunity and we're going to look at the other side now. Is that okay? So, switch hands here. Okay. do see a nice pretty gray. And again, I am seeing a lot of cerumen in there. So we're definitely gonna plan to get that nice and taken care of so we can take that cerumen out. So, like mentioned before, I am going to conduct the Ryan and Weber test. We're going to go ahead and conduct this by using my 512 megahertz tuning fork. I'm going to start off with placing the tuning fork on the top of her bone, and I'm going to be asking her if she hears the sounds equally to both ears or if she hears any one or the other a little less. Okay, so I'm going to go ahead and I'm going to hit this. You hear that? Okay. So, now that we know that you hear it, I'm going to go ahead and place it right here in the middle of your forehead, okay? I want you to tell me if it sounds equal on both sides. Do you hear it the same on both sides? Or if you hear it louder in one ear or the other, okay? All right, here we go. You ready? Do they sound the same? It doesn't sound louder in any of the other ears?
No.
No? Perfect. Okay, so now I'm going to start this test by what I'm going to do is I'm going to actually tap and I'm going to place it on the back of her ear. When she tells me she stops hearing that, then I'm going to move the tuning fork to the side of her ear, and she should hear it a little longer while I'm playing it on the side of her ear. You ready? Okay. So when you stop hearing it, I want you to tell me with there, okay? Okay.
I stopped hearing it. I stopped hearing it.
So that's a positive test. She is supposed to hear it a little longer, and I counted 7 seconds while I was holding it behind the bone, and I counted for 14 seconds while I was holding it to the side of her ear. So she did really good. Now we're gonna do the same thing on the other side, okay? We're gonna do the same thing. So I'm gonna place it here, and I want you to tell me when you stop hearing it, and then I'll place it right here to your side, and then you tell me when you stop hearing it, okay? Ready?
I stopped hearing it. I stopped hearing it.
Okay, and that is a positive. She did really good. She was able to hear it twice as long. She was able to hear it through the conduction of the bone. So now what I'm going to go ahead and do is I'm going to go ahead and take a look at her optic disc using my tools as well. I'm going to make sure that I see it nice and that I see no cupping. I'm going to have to ask you to remove your glasses for this one for me, okay? So you are going to see a bright light. I'm going to be looking into your eyes. While I'm looking into her eyes, I'm going to be checking also for corneal reaction, another cranial nerve. I'll be making sure that the pupil is dilating and constricting upon the hit of the light. I'm going to be looking at her optic disc and make sure I don't see no deformities as well. Okay? There we go. I'm not gonna turn the light on this one. Okay, so go ahead and look straight at me. Okay. I do see the cornea. Okay, I am able to see the optic disc. I'm moving around. It's nice and round. Okay, now we're going to go to the other side, okay? You ready? Okay. Again, we're looking at the optic disc. I'm making sure I'm not seeing no abnormalities. Keep looking straight for me, okay? Keep looking straight, don't look away. Alright. Everything looks nice and good. Alright, so I am able to see that optic disc, and I'm able to make sure that it doesn't have any deformities or anything. I'm also going to check pupil reaction. Go ahead and keep your glasses off for me. Now I'm going to do that by shining a little bit of a less powerful light. I am going to be checking for pupil reaction. I'm going to be checking for pearl. I'm going to be checking for the size, making sure that it is rounder and I don't have any deformities as well. Okay, so what I want you to do is I want you to look right here for me, okay? So what I'm going to do is I'm out of the side. Keep staring here, okay? Don't look over here. And I'm going to turn the light on, and then I'm going to shine it into your eye, okay? All right, ready? Look right here, okay? Perfect. I got a nice brisk reaction. We had constriction of the pupils. They went from a 5 to a 3, and I didn't see no deformities. The sclera is nice and white. Pupils are nice and reactive. Okay, we're gonna go ahead and check the other eye as well. Now I'm gonna be checking the right eye on the patient. I'm gonna be checking for that accommodation to the light. Okay, keep looking over here. Perfect. I did have that accommodation as well. Went from 5 to 3, so I do have the pupils. They're nice and equal, reactive to light. I am able to see no deformities, and the sclera is nice and white on the other eye as well. I'm gonna take this opportunity to go ahead and also look at the lacrimal ducts, making sure that I don't see any deformities, any type of clumpiness or anything like that, and making sure that they're nice and pink. Okay, so go ahead and look right here for me. Okay, I'm gonna pull down on your lid. Perfect. I do see the lacrimal ducts. They're nice. They're pink. They're looking nice and healthy. Perfect. Okay, so this time I'm going to take an opportunity, since I am continuing to go ahead and go over her eyes. I'm going to ask her to shut her eyes down nice and tight for me. Now, when she's shutting her eyes down nice and tight, I'm going to make sure that she is able to hold them, and I'm not going to be able to move her leg up or anything. Move her eyelids up. So here we go. Go ahead and close your eyes real tight. Don't let me open them for you. Okay. There we go. And I'm able to see that the strength is equal on both eyelids. I wasn't able to open them up or anything, and I wasn't able to force her eyes open at any time while I was going ahead and doing this. Okay. I'm going to go ahead and I'm going to take the opportunity, since I continue to work on the eyes, I'm going to test her ocular movements. And with this ocular movement, I'm going to be able to test her cranial nerves 3, 4, and 5. Okay, so here we go. I'm going to have this pen right here, okay? What I'm going to do is, without moving your head, okay, go ahead and put your head on so I can see, get your hair out of your face. Here, I'll hold your glasses. There we go. Okay, so I want you to look at this light, and I want you to follow the light with just your eyes. Okay? Okay, you ready? All right. So I was able to test that good ocular movement. She was able to hit all angles that I was approaching her with, and she did have that convergence when I placed the light a little closer to her eye. I'm going to go ahead and give her back her reading glasses. What I'm going to do at this moment, go ahead and put them on now. I'm going to go ahead and test her eyesight using my little Snellen chart. So in order to do that, I'm going to have her cover one eye at a time. We're going to go ahead and start, and we're going to get a good vision test for her. Okay, so this is what we're going to do, okay? I don't want you to put too much pressure. I want you to kind of put this over your glasses, and I'm going to hold this in front of you, okay? When I hold you in front of you, I'm going to go ahead and ask you to read lines for me, okay? All right? You can't fail this test, I promise. All right, here we go. No, above your, in front of your glasses. Just put it in front. There we go. I'm going to go ahead and have her use her corrective lenses while we go ahead and check her eyesight, okay? So with that eye, okay, I want you to read this letter for me.
S.
Start from over here.
D H J B S.
Okay, how about this one?
E P T Z O.
How about this one?
C F D H J.
How about this one?
L T F P H.
Perfect. So I went ahead and I jotted down 2020 on my Snellen chart. Now we're going to cover the other eye as well. Okay? Perfect. Okay, so we're going to start right here. Go ahead and read this line for me.
E P T Z O.
Perfect. How about this one?
C F D H J.
Okay, make sure we keep this eye nice and covered, okay? How about this one?
L T F P H.
Perfect, and she was able to read 2020 with both eyes, nice and equally. Okay. So now what I'm going to go ahead and do is I'm going to start testing some of her muscular movements. I know I'm still here at the head, so I'm going to go ahead and put a little bit of resistance, and I want her to turn her face against my hand. Okay, and I want to make sure that it is equal and that she does have nice strengths. Okay, go ahead and don't let me push. Okay. Okay, now we're going to do the same with the other side. Ready? 1, 2, 3. Good. Okay, now I'm going to try to push your head. Don't let me push your head. All right. See? Good. And I do have strength, a good, nice and strength on both sides when I'm trying to attempt to push her face or turn it to the sides. Now I'm gonna go ahead and move down to her shoulders. While I'm moving down to her shoulders, I'm also gonna be checking all her clavicles, making sure that I don't have no deformities, making sure I don't have no deformities on the shoulders, making sure that everything is nice and equal, nice and symmetric. And I do feel that there's no deformities on the clavicles, no deformities on the shoulders. I'm sorry, are you a little ticklish? Okay, sorry about that. Making sure that we do have a nice round shoulder. Now I'm gonna go ahead and I'm gonna move to the back and I'm gonna check the trapezius. I wanna make sure that I do have nice and equal definition of the muscles. Okay, I'm gonna be checking her scapulas, making sure that I have no deformities, making sure that I am able to feel everything, and I am. Okay, so at this time I'm gonna go ahead and take the opportunity and I'm gonna ask her to shrug her shoulders for me. Can you shrug your shoulders up and down? Perfect. Okay, good. Now I want you to go ahead and push up. Up, up, up. Okay, push up. Good. Now hold them up and don't let me push them down. All right. I do have nice and equal strengths while I'm able to go ahead and check all those motor system movements. Now what I'm going to go ahead and do is I'm going to check for range of motion in her shoulders. Okay, so what I want you to do is I'm going to ask you to go ahead and lift your shoulders nice and out for me. Perfect. Okay, good. Now go ahead and lift them forward. Good. I'm making sure that she does have nice equal movement and range of motion. Now we're going to move them a little back. You don't have to pick them up too much. Is it okay if I go to the other side? I'm going to come to this side real quick. Alright, so now I'm going to ask you to hold them up, hold them front, and then don't let me push them down, okay? Good. So I was able to make sure that she has equal strength to both sides. Now, push them down against my hands. Ready? Push, 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 push. Good. So she was able to have equal strength to both arms. Now I'm going to ask you to do me a favor. I want you to bend your hands. There you go. Okay, now pull, 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 pull. Don't let me pull, don't let me pull. Good. I do have that nice and equal strength. Now I want you to push against my hands. Push, 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 push. Good. I do got nice and equal strength, so I'm able to see her elbow. I'm going to go ahead and take this opportunity to check her elbow, check her arm. Again, make sure there's no deformities. Check the fingers. Okay, I'm going to check both sides, because what you do to one, you have to do to the other. Okay, now we're going to go ahead and check for flexion and extension. So go ahead and put your hands up, all the way, hands up, and then push them all the way down. There we go. So we're able to extend and flex both equally, okay? Not just put your hands against mine, and I want you to push against. The same way you did it right now. Push down, push down, push down. Good. Now don't let me push it. Push, 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 push. Good. I do have that equal strength to both hands, and I was able to get everything and make sure that she had equal strength to both upper extremities. I'm gonna go ahead and take this time. I'm gonna go ahead and check for deep tendon reflexes since I am in this aspect of the assessment. So I'm gonna start off with her brachiocephalus. Okay, ready? I'm gonna give you a nice little tap. You're gonna feel your hand move. Okay. Okay, so I was able to get that movement right there. Perfect. Now I'm gonna check her bicep. And I did get that movement right there as well. Cool, huh? Okay, now we're gonna check one side, I'm gonna check the other. And I was able to get that movement there. And then we're gonna do it again. Woo! Now that we were able to check the brachiocephalic and we were able to check the bicep, I'm gonna go ahead and I'm gonna check her deep tendon reflex right here. And I was able to get that movement. And we're gonna do it again over here on this side. Oh, that one didn't work too much. Oh, that one twitched a lot. So we do have deep tendon reflexes on both upper extremities, and I was able to go ahead and get them to react when I was able to hit her with a little reflex hammer. Since I'm still on the upper chest area, I'm gonna go ahead and I'm gonna listen to lung sounds and I'm gonna listen to cardio sounds. So with the diaphragm of the stethoscope, I'm gonna check both anteriorly and posteriorly. Okay, so when I place it right here on you, I want you to take a nice deep breath for me, okay? We're gonna start up here at the clavicle area. Take a deep breath. Good. Good. Okay. And I am hearing some clear, nice breath sounds. Good. I am checking the lower lobes at this moment. Good. Now that I've checked it anteriorly, I'm going to go ahead and check posteriorly at this moment. Go ahead and... Okay. So we're going to do the same thing, okay? Go ahead and take a nice deep breath for me. While I am listening to lung sounds, I'm also making sure I'm seeing the good, nice and symmetric rise and fall, not only of the chest, but of the shoulders as well. And I hear nothing but good breath sounds. I'm going to go ahead and take this opportunity. I'm going to listen for heart sounds. So on this side right here, I am able to hear the aortic. The pulmonic. Listening to Erb's point. Mitral valve. And then I'm going to go to the fifth intercostal space right here. And I am going to be listening to the PMI. While I was listening to the pulmonic, I was looking for the second close. Now, if you do have a patient where you are finding it a little more challenging for you to hear the PMI, you could have them lay on the left lateral recumbent position so that way the heart is really up against the chest wall and you're able to hear a good sound and you're able to hear a good heart rate. Okay, so at this time, I'm going to go ahead and listen to your abdomen. Now, the abdomen is one of those parts where you're going to do a little bit of your assessment a little differently. Typically, we would have the patient go ahead and lay down, but I'm going to just keep her sitting up for the purposes of the video. Go ahead and sit back a little. Quit scooting forward. No, sit back. Right there. Stay right there. You're good. Okay. What I would do is I would normally have the patient go ahead and lift their shirt over to the nipple line, and then I would also go ahead and I would fold down the shorts so that we could just check the symphysis pubis. Now, first, what I would start off with would be inspection. I would make sure that I don't see no protrusions, no hernias, I don't see no deformities, I don't see no discolorations of the skin. If the patient has any striae, I would be checking for that as well. I would be making sure that I don't see no scarring. That could be a little bit indicative of past medical procedures. Now that I have inspected it, I will go ahead and auscultate. When I'm auscultating, I'm going to start off in the epigastric area right above the umbilicus, just to make sure that I don't hear no bruise. And I don't hear no bruise. And I will go ahead and just move along. So I'm kind of listening. I'm listening right now at the transverse colon. Listening at the descending. I do have bowel sounds. Go ahead and check the other side. You're a little gassy? No? I heard gas in there. Okay. I heard that right there. So I do have active bowel sounds. So now what I'm going to go ahead and do at this moment is I'm going to go ahead and do some percussion. So So I'm going to be checking for the liver, and I'm going to be checking for the spleen on the left. So pretty much what you would do is you would use your middle finger, you give a nice little tap so you could get a good indication. You'll hear from a resonant sound to a dull sound, and that dull sound is kind of like where you're going to be feeling the liver. Okay, so now we're going to do the same thing. We'll be checking for the spleen. Sit up straight. Okay, perfect. And again, this part of the exam would be done while the patient is laying down, but for the video purposes, I'm going to go ahead and just keep her sitting up so that way we could see exactly what it is I'm doing. Now that I've checked for the spleen and I've checked for the liver, I'm going to go ahead and I'm going to check for the urinary bladder, and we'll go ahead and move on into palpation. So in order to do that, I will go ahead and just relax one hand, and then I'll put pressure with the other hand just so I can get a good feel. And what I would do is I would feel, I didn't need to pee. No. Okay, I can't really feel the urinary bladder. Usually if you feel the urinary bladder, that could mean that the patient does need a void, or does need to, use the restroom. Now, what you would, I would be doing at this end is, again, I would kind of palpate so I could get an idea of where the edge of the liver is. Now, what I would want to be doing is I would try to be checking for the edge of the liver by feeling it with my fingers. What I would go ahead and do is I would have the patient go ahead and take a deep breath in for me. Go ahead and release. And while they release, I will be putting a lot of pressure. And then I would tell her, okay, go ahead and take a deep breath in for me now. And then I would feel the liver edge while my fingers get pushed out by the inspiration. You could feel the liver edge. The spleen, you would really feel if the spleen was a little enlarged. Then you would really get that feel. You want to palpate along the abdomen as well. Make sure that you don't feel no hernias. Make sure that you don't feel no masses. And palpation is one of the things that you're going to go ahead and do last while you are able to go ahead and check the patient's abdomen as well. One more thing that I'm going to go ahead and do is I'm going to ask the patient to see if they could lean over for me so I could check the spine, make sure that the spine is aligned, and make sure I don't have no deformities or no protrusions. Go ahead and stand up for me. Okay, so what I'm going to do, go ahead and you're going to lean over. Okay, more. Look down. So while she's leaning over, I will go ahead and expose her back. I'm going to be looking at her back. And then what I'm going to go ahead and be doing is I'm going to be following the spine, make sure that the spine goes nice and down, make sure I don't have no protrusions, make sure everything is nice and equal. And I do have that equalness. I'm going to go ahead and take this opportunity while I do have the patient standing. I'm going to go ahead and ask her to go ahead and do a couple of movements for me so that she could go ahead and I'm going to test her gait. So what I'm going to do is I'm going to ask her to stand over there. I'm going to stand over to the side, face me. Okay, now with one foot in front of the other, I'm going to ask you to go ahead and just take nice steps. One foot in front of the other, okay? Perfect. So I am looking at the patient, making sure that she is able to balance, and she is able to balance. Now I'm going to go ahead and ask her to turn her around. Now I'm going to ask you to walk normally. Go ahead and just walk normal. I am looking at the patient's gait. I'm making sure that the patient does have a nice and equal gait, and that the patient is able to go ahead and walk appropriately. Next thing I want to ask you, go ahead and stand right back here, face the camera. Now what I want you to do is I want you to go from your heels, and I want you to go to your toes. And when you're at your toes, you're going to go ahead and walk towards the camera, and then I want you to walk away from the camera. Okay? Ready? Go to your toes. Walk towards the camera. Now walk back. No. Stay facing that way. Walk backwards. Backwards. Good. Okay, now we're going to go ahead and do the same thing, but this time we're going to go on our heels, and then we're going to walk forward, and then we're going to walk backwards. Okay? You need to take your shoes off for this one? Okay, go ahead. Good. Okay, perfect. Now that I have checked her gait, I'm going to go ahead and move into the final part of my assessment. I'm going to go ahead and ask her to sit down, and I am going to test, the the range of motion for her hips by having her press against my hands with her knees, and then we're going to test her strength of her knees, and then we're going to test her feet as well. Go ahead and sit down. Okay, so go ahead and pick this one up. Pick it. Good. Okay, now put it back down. Okay, now you're going to do the same thing. Push up. Good. Okay, so now we're going to do the same thing. I want you to lift this one first. Go ahead and push up. Good. So she's got nice, good strength on this left leg. Now I'm going to just make sure that it is equal to the right side as well. Go ahead and push up. Push, push, push. Good. Okay, I did have a nice equal strength on the right leg as well. Okay, so now what I want you to do, sit back. Right there. Now I want you, like you're dangling your legs, you're going to kick out. Okay? Good. Okay, so now kick against my hand. Kick, 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 kick. Just this one, just this one. Good. Now we're going to do it to the left side as well. Kick. Good. I do got equal strength. Now I'm going to do it opposite. I had her kick against my hand. I'm going to actually have her pull against my hand now. Okay? Pull. Pull it out, pull it out. Good. We're going to do this one. Pull, pull, pull. Good. So we are checking those motor reflexes as well. Okay? Now we're going to lift your leg for me. Okay. So I'm going to pick it up right here. Now I want you, like if you were driving a car, push the gas. Good. Now pick it up, point your toes towards you. Okay? Now push the gas again. Good. Point your toes towards you. Good. So I got a nice strength for her ankles right there as well. We're going to do the same thing. Push the gas. Good. Put it towards you. Good. Okay. Do you have any pain or anything? No? Okay, perfect. So that does complete my head-to-toe assessment. I had a great helper, and I'd like to thank you for everything that you did. Thank you for allowing me to assess you. Have a great day.